Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Thank you for the opportunity that given to me to present a study entitled Decreasing Degrees of Dyspnea in Chronic Obstructive Pulmonary Disease Patients through a combination of breathing exercise and relaxation. My name is Juliana and I am a postgraduate student at Faculty of Nursing Universitas Indonesia in the Medical Surgical Nursing Specialist Study Program. Mr. Muhammad Adam, Mrs. Tuti Herawati, and Mr. Imade Karyasa from the Department of Medical Surgical Nursing, Faculty of Nursing Universitas Indonesia, guided me in this research, as well as members of the research team. Ladies and gentlemen, shortness of breath is a common symptom that always complained by chronic obstructive pulmonary disease patients. Management of dyspnea in COPD patients is not only using pharmacological therapy, but also non-pharmacological therapy. Non-pharmacological therapy for COPD patients covers three main aspects that are breath, mind, and functional processing. Along with the development of complementary therapy in nursing science, nursing interventions that can be done at home begins in a great demand because of the cost and time effectiveness. One of the interventions is providing breathing exercises and relaxation for COPD patients to reduce the dyspnea compliance, increase the strength of breathing muscles, and prevent the readmission due to acute exacerbation. The purpose of the study was to see the effectiveness between the combination of forced sleep breathing and progressive muscle relaxation exercises on the degree of dyspnea. Ladies and gentlemen, this is a classic experimental study that was carried out into major public hospitals in Jakarta and Bandung from July 2019 to November 2019. A total of 40 respondents diagnosed with COPD grades 1 to 2 were chosen using consecutive sampling techniques and assigned into two intervention groups. The Modified Medical Research Council dyspnea scale was used in the study to assess pre- and post-intervention dyspnea. For 7 days, the group 1 was given a combination of forced sleep breathing and progressive muscle relaxation exercises for 10 minutes, twice a day. Similarly, for 7 days, Group 2 received forced sleep breathing exercise for 10 minutes twice a day. The severity of dyspnea was assessed before and after the intervention. Respondents and their families were given educational leaflets and sheets of the self-report exercises by the researchers. The researchers demonstrated the exercises to the respondents using a video tools. For 7 days, the exercises was performed for 10 minutes, twice a day, morning and evening before 8. From the second to the seventh meeting, the respondent was accompanied by the researcher and a family member or caregiver while performing the exercise procedure. Following the exercise procedure, the respondent completed a self-report form as evaluation material. On the last day of the study, this form of self-report is returned to the researcher. If the respondent is allowed to leave the hospital before completing the 7-day intervention, the researcher makes a home visit in the morning or evening, as agreed upon with the respondent, to provide assistance and evaluate the implementation. Ladies and gentlemen, as many as 85% of the respondents in the study were male. 85% of respondents are active smokers and ex-smokers. 82.5% respondents are frequently exposed to irritants and pollutants. 57.5% of COPD respondents had a lung infection. 55% of COPD respondents had no comorbid disease. 52.5% of COPD respondents use pharmacological therapy to treat compliance of shortness of breath. 52.5% of respondents fall into the category of poor nutrition, and 90% of respondents have low income. Development age of the patient was 55.5 years, and the mean length of suffering COPD was 2.53 years. Ladies and gentlemen, further investigation revealed a significant difference in the degree of dyspnea in COPD patients before and after a combination of pulse sleep breathing and progressive muscle relaxation exercises. In the study, however, there was no difference in the degree of dyspnea before and after pulse sleep breathing exercise. The degree of dyspnea after exercise differs significantly between the two groups according to the results of the analysis. Ladies and gentlemen, the study's findings show that there is a difference in the degree of dyspnea after performing a combination of pulse sleep breathing and progressive muscle relaxation exercises. Thus, combining pulse sleep breathing and progressive muscle relaxation exercises has an indirect effect on improving lung function, as evidenced by a reduction in dyspnea after 7 days of intervention. Except for the degree of dyspnea, improvement in lung function and function in COPD patients can also be assessed using sputum production, spirometry values, and the number of exacerbations. As a result, this study can serve as a reference and preliminary data for future research for COPD patients by investigating the relationship between the combination of pulse sleep breathing and progressive muscle relaxation exercises and other indicators of disease severity. The recommendation from the study is the need to improve the development of complementary therapy programs in nursing education and services by modifying nursing care standard with the combinations of pulse sleep breathing and progressive muscle relaxation exercises for COPD patients. That's all from me. Sorry for the lack of delivery. Thank you very much for your attention. I hope this research can provide maximum benefits for health empowerment in Indonesia. Finally, wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.